I will be demonstrating a subcutaneous injection. The needle gauge for this injection is 25 to 28. The needle length is 1/2 to 5/8. I will be washing my hands. I have gathered all of my necessary supplies. I have checked my manufacturer's recommendations on those supplies. I have checked my facilities, policies, and procedures. I have checked to make sure that the procedure falls within my own scope of practice. I am going to knock on my patient's room. I'm going to introduce myself. I'm going to provide for privacy by shutting the door, closing the curtain, and asking family members to leave, to step outside. Hi, Miss Jones. My name's Heidi. I'm a nursing student at WKCTC. I'm here to give you your subcutaneous injection. This is your insulin shot. This injection is administered in the abdomen, 2 inches away from the umbilicus on either side. The upper outer aspect of the arm, or the anterior aspect of the thigh. Where would you like the shot today? Wherever Mrs. Jones chooses to have her shot. It's alternated, so if it's the right abdomen today, it's the left abdomen tomorrow. But it stays within that same site. So I'm going to give you your shot, your insulin shot, Miss Jones. Like I said, this should only take a few minutes. This shouldn't hurt. My order is for 20 units of N and 15 units of R. I will insert 20 units of air into N. I will then insert 15 units of air into R. I will then pull my needle back. And I will draw back 15 units from R. Here's my 15 units. And then I will draw back my 20 units from N. When you mix insulins, it is clear into cloudy. So you draw from your clear and then into your cloudy. I don't know how to make that. There it is. Here's my 35 units. I will scoop my needle. I'm donning my PPE. Okay, Mrs. Jones, where did you want this injection? I go from the center and I clean outward like a bullseye. If Mrs. Jones were a heavy person, I would pinch the skin. If Mrs. Jones was not a heavy person, I would push down on the skin. Since this is an insulin injection, we're going to assume Mrs. Jones is heavy. I will insert my needle at a 90-degree angle. I will relax the skin, and I will insert my medication. I will engage my safety. And put my used needle in my sharps container. I will apply light pressure on the injection site. I will remove my gloves. I will document my findings, raise the bed rails according to the patient's care plan, report any abnormal findings to my charge nurse, and I will wash my hands.